Hi, everyone, and welcome to the Health Revolution. I'm your host, Adriana Morrison, and we're excited that you are joining us today. Remember, our show is all about engaging conversation, elevating health and wellness, and empowering transformation. And that's not just the physical piece. We're talking the mental piece and all around comprehensive approach so that each and every single one of us can live our most optimal life. And no matter which way you're tuning into us, remember, don't forget to hit the subscribe button at the very bottom. And that way we can stay connected with you going forward. And there are show notes at the bottom of this screen that I want to bring to your attention. Don't forget that you can hit the tab down button, and that way you can reference important information that's very relevant to today's topic. And I'm excited about today's topic because it is an important discussion that we always need to have, but the importance is to be aware going forward. We get the opportunity to talk about breast health solutions and all that that implies, especially when we're dealing with the statistics involving breast cancer. And there is no one other than my next guest who is very well versed and who can speak on this platform where we can really dive into some of these solutions. First, take a look at this video. Let's get to know who he is. Meet Dr. Jawad Mustafa. He's a leading expert in breast health and a family physician with over 17 years of clinical experience. He uses an integrative medical and holistic approach towards breast health to promote self-breast awareness and to educate adult women on reducing avoidable risk factors for breast cancer. As an online ultrasound master trainer and telemedicine consultant, Dr. Jawad Mustafa also founded BeBreastAware, a nonprofit initiative in Pakistan dedicated to promoting early detection of breast cancer. In 2022, he launched the nonprofit blog Medscope, aimed at improving healthcare awareness. His commitment to healthcare and patient education makes him a trusted and knowledgeable breast health coach. Dr. Jawad, welcome to the show. I'm so glad that you're here with us today.
Thank you for the opportunity.
So let's dive right into it. I know that you've got several years, to say the very least, underneath your belt. And explain to us, why does it matter that it's beyond the diagnosis and the type of solutions we need to start looking at as a society? Can you dive into that for us?
The first thing should always be self-care. The first thing should be awareness. The first step for every person should be to know about their own health, their own body requirements, and how they can reduce the chances of getting any kind of disease or problem. Because getting pills or any kind of surgery, this is not always the solution. The first thing should be how to improve ourselves, how to gain knowledge, which is pertinent and particular to our own health situation, and applying it to keep ourselves healthy in a better way and to perform in a better way. Because every person is living in a society where their contribution matters. So their family, their society, their country, they all are linked with their own health, their own performance. And if they are feeling healthy, they are feeling good, then definitely they can have a positive impact on the society as well.
So you've been a family physician for quite some time. At what point did it occur to you that that you started to have a growing concern about this being something we need to look at in terms of in terms of breast health?
Actually, I belong to Pakistan, and my native city. It is, you can say, a semi-urban kind of city, not so much developed, and all the surrounding area, many hundred kilometers, the surrounding part, it is a very less developed part. So I have been getting more and more cases, more and more females, especially in the younger age group, where they feel a lot of breast health issues. But the problem is about awareness. Because mostly they were told by the healthcare professionals, by their family, and the common perception, even in the developed countries, it is that whenever in younger, even in late teenagers or in 20s and 30s, if you're getting some kind of minor issues, minor problems related to breasts, nipples, or breast growth or development. They People usually try to ignore these or try to tell these younger females that you don't have to worry, it is all part of the aging process, growing process. So in all these scenario, more and more females, when they reported, they either had more complicated cases or advanced breast health issues or even cancer. I have seen cases in mid 20s. The youngest female was 22 years of age when she had breast lump and was diagnosed with cancer. And sadly, she didn't survive because it was too late for her to get all kind of treatment. So, with the number of cases increasing and with all this thing going on, when we have more and more carcinogens in our environment, in our diet, in our lifestyle, so it made me realize that there should be some kind of effort that should promote health awareness, health education beyond the normal and the routine. So that's why I started first giving all this information in my own clinical setup, and later on, gradually I expanded it through online sessions. And now this BeBreastAware is the organization that I founded. So the main purpose is to educate and guide each and every female, whoever can benefit from this, because the only way to reduce the risks, the only way to save life is through proper awareness and early detection.
It's as you and I were talking earlier before going live, I found it alarming that there's not enough discussion that's out there. And I'm me being a woman, I'm very aware that that the self exam, the breast cancer awareness, that happens as we get older. Why do you think that we're just not having, just society across the board, why is it that we've not yet had a lot of conversations for women who are younger, who are affected and can be affected in much younger years? Why are we not talking about it? Why has this been just not as common?
The fault lies with our healthcare system and our own public perception. Both are to blame for it. Because in the healthcare system, it is designed to care and to provide facility to those who report as a patient. So only those persons who are registered with them as a patient or as someone who are at some kind of risk, heavy risk, only they are reported and they are treated accordingly. But those females or those person or any person who is having a mild to major risk but they are not yet diseased, so the healthcare system is not equipped or is not capable to guide all these person who has not yet developed any kind of symptoms. And same goes with the society, that we tend to ignore things, we tend to ignore minor signs and symptoms. So in all this scenario, the main perception, the main research, and all the statistics were that breast cancer usually presents after the age of 40 years or 45 or later. So the screening process started by the age of 40 years in most countries. In some, they do allow above the age of 35, but by this time, the growing breast growing age is from 10 to 12 years till the 39 to 40 years age. Of this 30 or 25 years of gap, this lag of communication between the healthy person and someone who is under screening, this age group 15 to 39, this is not screened by any healthcare group, any healthcare system. So
Would would
the
you say,
main thing
oh, I'm sorry, go ahead.
So the main thing, the main purpose should be to educate and guide and keep this segment of females 15 to 39 under any kind of direct guidance, coaching, or any kind of system where they can report even the minor symptoms, not just cancer. There are so many more things that can happen. So this is the main focus of my organization and my efforts, that we have to educate and guide these women who are between 15 to 39 years of age, which is the unscreened group.
You know, it It's surprising to me because this is the first that I'm coming across. And of course, it's important to be aware of innovative information and things that we're discovering. So 15 to 39 years, that age range. Do you think that just in terms of science and the studies that go behind it, is it that the notion is that it's rare? Do you think that there's a misconception that it's rare to have the diagnosis in this age range?
It is rare to have a diagnosis between the age of 15 to 20 years. It is rare. But the figures, they drastically increase between the age of 20 to 39. And in the latest studies, breast cancer in between 15 to 39 is among the leading cause of deaths due to cancer in this age group. So it is not something that is totally rare. Even if the chance is 1%, that one female matters. So we have to educate and guide all these women, because even if their chances are less, but the factors that trigger the cancerous changes, they start in the teenage. They start as the breast development start, because the hormones that are the main root cause, the estrogen hormone, that is one of the major causes of breast cancer. Its highest level are between the age of 12 to 13 till 35 years of age. This is the maximum exposure age group of estrogen hormone, and it is one of the most common and most, uh, you can say, effective causes of breast cancer. And its effect is between this age group, but we are educating and guiding those who have less estrogen after the age of 40 years. So the maximum exposure time, this is between 15 to 35 or 40. So we have to guide and educate these women that you have to start caring for yourself. Check for signs and symptoms in your breast, whether you have any kind of problem or not. You have to regularly examine yourself in the proper way, not just those advertised things on the internet or the booklets that just palpate and find anything. It's not just that thing. You have to be fully equipped with the basic information that the visual examination, it should be done on a regular basis. It can be done on a daily basis to check for any kind of difference, any skin changes, any lumps that may be visible on the skin as well, any bumpy skin or any rash or marks, and any kind of difference. So it can be done on a daily basis, and the monthly examination can be done on a monthly basis. But mostly this information is not given properly. Only it is celebrated in the month of October, but rest of the year it is just brushed under the carpet.
It's fascinating how as you're explaining this, it's coming to mind that yes, the month of October is something where we put emphasis on, but the continuing basis is something that it's extremely critical. I will tell you that you're the second clinician that we've been privileged to have here on the show that talks about earlier and earlier detection within that stage in terms of hormones. Have you found that colleagues and those that you've interacted within the medical field feel the same way as you? Or do you feel like, I really wish that more clinicians and more specialists would have conversations that could get the ball rolling?
Actually, this is the sad part, because our medical education system, the research that we do, it is on those cases that were reported a couple of years ago, 1 year or 2 year or 5 year data. This is collected, but the risk factors, they have drastically changed in the last couple of years, especially after the pandemic, because due to the sudden change of lifestyle, we have all shifted towards sedentary lifestyle. We have all shifted towards the food items that are processed, that are ready to eat, that have a lot of carcinogens in them, a lot of items in our cosmetics, in our clothing, that have dyes that can be carcinogen. There is a more and more increasing number of carcinogens in our environment. So the risk factors, they keep on changing, they keep on increasing by every year. So the data that is collected is 2, 3, 4, 5 years back, but the rate and the pace at which this disease is increasing, it is alarming. So we have to be proactive, not just relying on the data or statistics. We have to think beyond that. We have to see what is happening in our own locality, in our city, in our state, because one factor may be present in one state where the research is going on, but the other state, it is having more exposure towards carcinogens. So every healthcare professional should be proactive. They should be looking towards the causes, the probable causes that are more prevalent in their locality and society. So everyone should be proactive, and they should guide and educate all these women who report to them that these are the risk factors that are common, but in our area there are some specific concerns that I have that you should also care for. So that's why the things are changing. They are increasing at a very rapid pace, and it's very hard to cope up with all this increasing number of risks that even our children have, women have. And that's why it is very important that we should initiate discussion on all levels, not just healthcare professionals, on the government level, institutions level. And there is one very particular thing that I want to point out, and that is our diet. It has a very crucial role in our hormonal balance. The things we eat, if they contain those items that are rich in carcinogens or processed meat, or those that have tendencies like estrogen, even if a person, if a female has normal estrogen levels, she may be taking those food items, she may be using those plastic materials that inside the body can mimic like estrogen, so the estrogen levels increase. It puts them under high load of estrogen like chemicals. So government should make policies. There should be a combined effort that everything should be standardized. Every food item, processed food items, they should be screened for the level of carcinogens and the level of estrogen like components, the phytoestrogens in them, or xenoestrogens. So, and the second is all the health, all the food industry, they should be concerned about it. They should be also taken on board that these are the risk factors that are causing increasing number of cases in women. We cannot advise. This is a sad thing that I have when I have to call a patient and tell them that you have to quit all kind of junk food, all kind of oily and fried food and deep fried food. This is part of our lifestyle now. So instead of criticizing their food choices, we should be sitting together with the food industry that you have to come up with those food technology, food sciences, that the amount of carcinogens, the amount of estrogen like components, those chemicals, they should be reduced without affecting the taste, without affecting the overall health value of the food that you are processing or making or selling. But
You know, it's funny that you say that, because it makes complete sense, and yet at the same time, the food industry appears to be a whole other bear, in that, it definitely varies with how much, what their contribution is, and the type of ingredients that are that are introduced in foods in order to make consumers out of those who are consuming the food. So then it becomes this, it seems as though that they want that the value is more about being the consumer versus our health. Would you agree?
definitely. So that's why it is about time that we should sit together and make a policy that the food should not just be tasty, it should be healthy also. So the food sciences have evolved. We have developed so much technology and the genetic engineering and everything. So why not come up with those oil-like components that are safe, with less chemicals, which tastes the same like that we are eating at the moment. So the food should not be just tasty; it should be healthy also, because this food item, these processed food, these oily based foods, they are part of our diet now. We cannot eliminate them, but we can make them healthier, because these food items are contributing towards risk for cancer. So why not change little bit in the food industry also?
Why not? Absolutely. We're going to go ahead and take a commercial break. We will be right back after this. Stay tuned. We want to give a quick sponsor recognition to Biomed Mobile IV, Colorado's top mobile IV services, and we appreciate their sponsorship of the show. Welcome back. I'm your host, Adriana Morrison. We've been spending some quality and important time with Dr. Jawad Mustafa, and he has been an expert. He's family physician, breast health coach. He is here to help us discuss the pioneering breast health solutions that allow us to really move the needle in terms of early detection and awareness way earlier in which we have been used to in societal times. So, Dr. Jawad, I appreciate you being here. And we were talking about some of the concerns that you've had, some of societal's trends that you've noticed, you being in the forefront of this field. What are some things I want to talk about? Some early detection, and I know that we have some slides to go over, and I'd like for us to share with our viewers. And if you can talk, let's talk about the first slide, one in which we have detection that you were able to notice in terms of a small lump. We'll go ahead and we'll bring up that slide here, and then we'll see if we can delve into that. Talk to us about some of the things, some of the findings, and what you noticed that we need to be aware of.
So this patient, this female, young female in her 20s, she reported for a regular examination, because I have been guiding and teaching different patients that they should be aware, self-aware, and they should have annual examination, whether they are in their 20s or 30s, with or without any symptoms. It is better to be get checked. So this female reported, and she asked for a regular ultrasound just to make sure that everything is going smooth. She was not able to find any kind of lump. I did the examination. There was no lump there, but this is a very small lump, less than 6 millimeter of size, less than you can say a pea size lump that was present. it is not cancerous, it is benign. But simply knowing that there are some kind of lumps that may be present without them knowing it, they cannot palpate because they are very small in size. So to find any kind of lump, this was an accidental discovery. It was a normal lump. These are mostly fibroadenomas. They are not cancerous. But if that lump was showing any kind of signs or symptoms of being a cancerous lump, this discovery would have saved so much cost of her treatment. Without this, could have saved her from getting mastectomy, removal of the breast. This small part, small lump would be removed, and she would be saved from all the complications. So that's why early detection is very crucial. Imagine this kind of lump being removed and without any kind of scar and any kind of breast removal. It should be a very crucial thing for any person.
So you mentioned that this was an accidental discovery. Now, did you go ahead and initiate a routine ultrasound, and this is how this turned out? Did she have any other indicators or concerns that she wanted to make sure that everything was okay and that things were checked out okay?
There was nothing wrong with this female. She was perfectly healthy in her mid 20s. There was no complaint. But as I've been guiding and coaching that more and more females should be aware, they should get screened on yearly basis because the mammogram is done above the age of 40 years. So below 40 years, ultrasound is the safest option. It can be done in any female, any age group without any side effects. So as I do ultrasound on a regular basis, that's my specialty. So that's why I encourage females to get it done on whatever time they feel suitable, comfortable. So this was just something that she did just to make sure, and there it was.
So, it brings the attention to me that, that this was something that you were able to detect. Uh, is this something that any patient that you find, is it something that women can request? Is it something that in general is an option that women can do, but it's just not something that we know to do? Or what can you tell us about that?
In my part of the world, everybody has access to ultrasound. They can get it done from any private setup or government setup as well. But in most countries, where due to certain parameters, where they don't allow any walk-in patient or person to get any kind of investigation done, they have to go through certain protocols. So this ultrasound screening of breast should be made free for everyone. They should be allowed to get ultrasound done whether they feel any kind of symptom or not, just to make sure everything is going fine. They should not be just bound with getting any kind of cancerous lump, because there are many things that can be detected on ultrasound: congestion in the ducts, any kind of cyst formation. If there is any kind of pain, persistent pain, there can be fibrocystic changes due to hormonal changes. So they can all be detected on ultrasound without having any kind of problem or threat or any kind of radiation exposure. So it should be made available to every person, every female, whether she is showing any kind of sign or symptom or not, because this is a screening tool that can be very helpful.
I do like that. And I'd like for us to move on to the next slide. So I know from small lumps now we're looking at multiple breast lumps. Can you share a little bit about this ultrasound and the findings that we really need to home in on?
This was a young female in her early 20s. She had 13 lumps in her breast, 7 in one and 6 in the other. And she was just able to do 2 lumps in one breast only. She was concerned, but the family and all the doctors she went to, they told her that you don't have to worry. Small lumps are common in young age groups, just forget them. But on ultrasound, I was able to detect 13. So, if any person, any female who is having lots and lots of lumps, it definitely has some kind of underlying process going on that may be making her get more tendency towards cancer. These all were non-cancerous lumps, but the same hormones that are feeding these non-cancerous lumps, they are responsible for the development of cancer in the later year. So it is very important that she should get proper consultation, proper guidance about her diet, about her lifestyle, about balancing the hormones, her weight, because unless she is taking care of herself right now, she is increasing her chance of getting cancer in the early years. So that's why we have to guide and educate every female that whether you are getting any kind of obvious signs or symptoms, any lump or any burning sensation or any rash, even if you are getting minor pain, it is better to get it checked out to make sure that nothing is wrong, nothing harmful is going on. So it
Now,
is
just
better to
out
be
of
safe than sorry.
Yes. Now, just out of curiosity, for this particular patient, were there any other female family members that that were made aware of this? Like, for example, did she happen to mention that there were other female family members? And did they? And if that were the case, were they able to take initiative and take proactive steps to check themselves out and to start this process of screening?
She reported with her mother and younger sister. So definitely, the first step was to educate them about the reasons and the causes, and what steps they can do for themselves, for the other family members. So it is always a step-by-step process. That's why, to make it easier, I have provided all the kind of basic information, basic to advanced, on my website, BeBreastAware.org, that every person can go to, any person can visit, they can have all the information there. So instead of giving them each and every step to every patient, I have made it simpler for them to get the information on their own. And if they feel any kind of problem or query, then they can contact me or any of the healthcare professional in their locality, or they can visit them, they can have discussion with them. But the first step is always to be aware, to know what can be the probable causes, what can be the reason of it, and what they can do to further reduce their risk.
So we talked about the small breast lump and multiple breast lump. I know we have another slide here that I'd like for us to share with the viewers, and that is abscess under the nipple and areola. Can you explain a little bit more what we're looking at? And because I know for me that I'm not able to detect, but your expertise, definitely would love to know more about this slide.
This was very alarming for me also, because she was a 19-year-old student, college student. She was complaining of breast pain for more than a month to her mother. But as always, as in most societies, they always tell them you have to ignore, this is minor pain, minor discomfort, don't worry about it. Actually, she was getting this pain in her right breast, in the nipple area, due to improperly fitted bra. It was causing the rub on the nipple. It was causing the skin abrasion and skin crack in the nipple. It was warm weather, and due to her routine, the study routine, and every harsh weather environment, due to sweating, due to excessive pressure and the rough skin, all this contributed to formation of the abscess. And as she was not caring for it, due to the skin crack, she was getting mild discharge from the nipple area. She used to wash it with the soap, with the body wash. That soap or body wash on the breast or nipple skin, in any person who has sensitive skin or skin dryness, it causes extreme dryness. That dryness increase the crack. That dryness increase the formation of the abscess. So it came into a vicious cycle where within a month it developed into about 9 cc abscess around the nipple, under the nipple and the areola. And when it was unbearable for her, then she forced her mother to take her to a clinical setup. She reported to me. I examined her. I did the ultrasound, and there it was. It was an abscess just cause of improper information, improper care, improper bra use, improper skin care, and negligence on the family part. So it is always a consequence of complications of different things. So nothing should be ignored. No sign can be ignored, because when it develops into something serious, then it is very hard to control it. She had to take about 10 days of antibiotic treatment just to resolve this abscess. So
Wow. And you said that she was 19 years old. So this is,
yes.
obviously I'm going to venture out and say that this would be a common situation that, say, women experience, especially with just any sports apparel or active wear that you're trying to, that a woman is trying to have the support that she needs. But then it seems like there's a fine line and that this could happen. So then have you seen this on obviously you've seen this on more than one occasion. Is this common that you see this abscess under the nipple and areola situation? Is this common that you've seen?
Yes, it is common. This is more common in lactating females, those who breastfeed, because due to cracks and due to any kind of cut, this happens quite a lot. But in younger females who are not breastfeeding, it is mostly due to improper bra use. Because if it is not properly fit, if the fabric is not all right, or if it is putting too much pressure, or even the loose ones, because due to breathing and any kind of activity, whenever there is friction or rub on the nipple skin, it definitely gets bruises or cuts or cracks. So it is always about knowing your own breast and nipple health, the proper size and the skin type, because you have to wear the appropriate shape and size and type of bra material. Also the skincare product, this body wash, the soap or anything, it should not be something that dries the skin up, because it is causing the natural protective layer, the lipid layer over the skin. When we wash it, then it comes more prone towards cracks and getting infection.
Wow.
So always the sensitive skin, the baby shampoos and the baby body wash, they are more suitable, particularly for the breast and nipples. So that's why using any kind of harsh chemical or any creams or lotions that are used to improve the skin tone or texture or to increase the size, they are all very dangerous, because they all disrupt the normal skin texture and makes it prone towards getting different skin problems, skin rash, skin inflammation, and even they all increase the chance of getting cancer because of their tendency to have carcinogens in them.
Wow, that's incredible. I've not given thought to that, but this is obviously something that women need to be aware of, that we should all be aware of. And I know we've got one more slide. We're going to go ahead and go into a commercial, and then as we return, we'll definitely talk more into that. So stay with us. We will be right back. Thank you so much for watching The Health Revolution. Our show is growing, and it's all thanks to viewers like you. No matter how you found us, please hit the subscribe button so we can stay connected and continue to deliver amazing content to you.
Life is so fragile, and we're constantly reminded just how fragile life can be, especially when we or a loved one is told we have cancer. Cancer survivor myself, I can tell you, we still feel very alone in this journey.
There's a study that's been showing that patients who are socially isolated have a worse prognosis, have a worse outcome than patients who are socially interconnected.
Buddies for Life is a non-profit cancer support group for those whose life has been impacted by cancer. Humor, hope, heart, and hugs.
Humor, hope, heart, hugs, and a whole lot of love.
Share this with your friends and family and support this community in every way you can. No one should face cancer alone.
I am a chemo buddy for life.
We are a buddies network.
No one does cancer alone.
Be a buddy.
And we are all here for you as a community of love.
We are chemo buddies for life.
And if you've heard 3 words, you have cancer, for yourself or someone else, you belong with us at Chemo Buddies for Life.
Healing through connections.
Welcome back to the Health Revolution. I'm your host, Adriana Morrison. Our guest today, Dr. Jawad Mustafa, who is an OBGYN ultrasound consultant and breast health coach. And he's been sharing some incredibly important information about breast health solutions and breast care in general and how we need to be starting earlier and earlier in terms of initiating that awareness and advocating. So Dr. Jawad, I appreciate you being here. And of course, we've been going through some of the slides that you've been sharing with us, some of the details that in your findings and why this has been so critical. So we covered the small lump, the multiple lumps, the abscess under the nipple and areola. And now I'd like to go into breast cancer. And I know that you have a slide that you brought with us for us to our viewers to see today. Share with us what you see here and what led to the findings and what in going forward from this discovery.
So that is breast cancer, the lump which is irregular in margins, which is fixed to the tissue. So this is the mostly advertised thing that every female is asked to do, to check if she finds a lump which is hard and which is irregular and which is fixed. So it looks like this on an ultrasound. But at this time, when its size is increasing, it is more than a pea sized, it is more than almond sized. It is definitely growing in the armpits also. So at this stage, it is stage 3, where it is hard to control, it is hard to manage. We have to remove the whole breast tissue. We have to remove all the lymph nodes along with it. So why not detect it when it was small? The only way to detect it when it was small is through ultrasound. Because whenever a person, when she is not feeling any kind of symptom, then she is in stage 1 or stage 2, where the small lump is very small, it is not giving any kind of problem, it is not invading any kind of surrounding structure. So my mission, my aim is to detect the cancer at stage 1 or stage 2. Because once it is spreading, once its size is increasing, then we can only control it, we cannot eliminate it completely. It can be cured when the spread is less, when it is not spread towards the liver or the bones or the lungs. But we can only control it when its size is small. We have to detect it early in stage 1 and stage 2. It has complete recovery. Up to 95% cases can be treated completely. So we have to look at the numbers which are giving us more and more hope that it can be cured. So why not detect it early? And
So
in
with
this case, yes.
oh no, I'm sorry. Go ahead. Go ahead.
So in this case, it was already stage 3. It was present in the breast as well as in the lymph nodes. So it is time when we have to remove this whole breast, this armpit lymph nodes. We have to do the radiotherapy, chemotherapy, and it is a very painful process. It is a very costly process. So to reduce the cost, to reduce the fatigue, to reduce all the stress and anxiety on the patient, on the family, and the healthcare system, we should be screening at an earlier age. We should be screening in an early stage. That's the only way to improve the chances of getting complete cure, to increase the lifespan and life expectancy and a healthy life. for
So
any
with
female.
this patient, how old was she? I'm just curious. And was this the initial discovery that she had breast cancer, or were there other concerns leading up to this particular ultrasound for this patient?
She was in her late 30s. She had family history, and when she detected that she had some kind of lump, she got scared. She didn't tell anyone because she knew in her mind that there was something going on. But just the fear and the phobia that she had seen in her family, that that her relative had to go through, it made her scared so much that she didn't tell anyone. And by the time when it was more obvious, it had signs on the skin also. When there was nipple dimpling, there was the nipple retraction was there, then her husband forced her to get the consult, and it was already late. Not too late, but it was late.
Right. And so again, reemphasizing your point about early detection and going upon instinct, that if something is there, to definitely get checked out. In terms of your discussions with other providers, or as support is being offered to patients, what do you notice the dialogue with other clinicians when you share findings that maybe other clinicians weren't sure that it was breast cancer? Or, and this is, and I'm just speaking in general terms, that where maybe a patient just is insisting on making sure everything is looked at, but her previous physician just dismissed it. What has been the dialogue? What has the dialogue been like as you discuss with clinicians and you reaffirm your concerns about breast cancer?
Actually, we are all to blame for all this scenario that is going on. Each and every person, including me, all the other healthcare professionals, the society, our healthcare system, and our education system. Because we are not providing females, the younger females, about the proper resource and or the way or the step in which they should approach towards healthcare provider. The first thing should be, the first education should be in the high school, because the females, the younger girls, they should be advised that whenever you feel any kind of symptom, these are all the signs, these are the symptoms, these are the checklist that you have to do on a regular basis. If you feel anything, you have to tell your mother, your elder sister, or your teacher. There should be a trained teacher in every school, every college, every university, who is trained, who has enough information and education about the basic concepts of breast health and breast cancer. Because she should be the one who she can report to. They can discuss with the doctor, with the healthcare professional in her system, where they can discuss about the possible causes, the issues which may not be cancerous. But if she's having any kind of hormonal issue, any emotional distress, any kind of nutritional problem which is causing any kind of problem in her breast health, so why not get it sorted in the early years? Then rather than she has to wait when it is more and more obvious for everyone, then she gets the treatment. Why not getting it treated in the early time? This is this problem with the healthcare professionals also, cause we are too much stressed with the already existing burden of the disease of the patients, and all the limited resources that we have. Even in the developed countries, there are very limited resources that are at disposal of the healthcare provider. So it involves every community effort, localized effort, and on a large scale effort, that we have all to contribute bit by bit to increase the awareness, increase the chances of treating problems when they are small, when they are not so much aggressive. So we are all to blame for this situation that is happening, not just for the breast health or cancer, but every other thing, that we all have to improve our knowledge, our skill, as well as acceptance of the things that are happening in our surrounding right now.
For sure that we have to have these conversations. And I know that it starts with discussions like this. And we're going to take a quick commercial break. We will be right back after this. Stay tuned.
This is Madeline Blair, the host of Unlocked, where we open possibilities for when the unexpected happens. Join me Thursdays at noon and again at 8 p.m. Eastern Time on the Business Network, right here on E360 TV.
Welcome back to the Health Revolution. I'm your host, Adriana Morrison. We've been spending some quality time with Dr. Jawad Mustafa, and we've got a few moments left. Dr. Jawad, where can people find you?
Well, I'm mostly available on Facebook and LinkedIn. I'm quite active there. And also, I volunteer in different groups related to breast health, breast cancer, and different health conditions, but that is totally free. And also, they can contact me through my website, BeBreastAware.org. It is a free website. Anybody can sign up there. They can get all the information. And also, I'm part of a new Florida-based startup, Global Care Council, where I'm working as breast health coach. And we have got some holiday promos and holiday gifts for everyone. Anybody can visit the website globalcarecouncil.com slash offers, and they can download the free booklet. It has all the information, all the basic necessary information. Every female should read it. It is free for everyone. They just have to sign up there and download the book. It's free. And the second thing is we are offering free breast health and cancer assessment survey questionnaire. Everybody, every female, they can go through all these questionnaire and they can self-diagnose if they're having any kind of problem. They can contact me on the website, through the emails, on Facebook or LinkedIn. So I'm here to help and guide each and every one of them, whoever I can. So these are all the things that I can provide. So I hope it helps.
No, it absolutely does. And we appreciate you sharing that information with us. And I'll tell you, we are out of time, but thank you so much for sharing with us your knowledge and the importance of early awareness, which is way earlier in which that's oftentimes emphasized in society, but the extremely early awareness that can help us catch and be on top of taking those actionable steps to for breast health and breast health solutions. And thank you so much for being here. Appreciate you.
Most welcome. Honored to be here, and it's great to engage in this conversation. Thank you.
Absolutely. And for those of you who are tuning in to us for the first time, don't forget to hit the subscribe button. We would love to stay connected with you. Remember that you can find us. Our website is thehealthrevolutiontv.com, where you can also subscribe to our newsletter. That allows you to stay up to date with ongoing information about how the show is rolling along. In addition to that, you can also share with us any input, any show topics you'd like to have us covered, because we are doing all things possible to make sure that we have the guests that can initiate those right discussions. Don't forget that we are on E360 TV Tuesdays and Thursdays, 10 a.m. Pacific, 1 p.m. Eastern Standard Time, right here. And with that, we are out of time. Thank you so much for joining us. Until next time, take care. We will see you soon.